My name is Gary Whittaker. I'm a professor at Cornell University in the College of Veterinary Medicine. I'm a professor of virology. FIP is feline infectious peritonitis, so it's a really important, one of the leading causes of infectious disease deaths in cats right now. It's really interesting from a scientific point of view because essentially the same virus is able to infect macrophages and trigger this lethal disease at the same time as this very similar virus is infecting the intestine and really causing no disease at all. We know that the virus that causes FIP does this through infecting macrophages, and really the question is what is happening to the virus to allow that process to happen? Why is the virus changing, or how is the virus changing so it can infect macrophages and trigger FIP? We should care because right now there's no ability to really diagnose FIP in any significant degree. There are tests available, but they really don't discriminate between this benign form and the pathogenic form. So one overriding goal of our studies is to develop a discriminatory test, which will at least be able to give pet owners and veterinarians information, because in many cases FIP is very hard to diagnose clinically. The next steps in my research are really in the shorter term to translate our sequencing studies that we're doing in the lab into a diagnostic test. So we're working hard on trying to develop this and validate a test, and so hopefully even within a matter of months we're hoping that we have a final product that can be released for the community to use to diagnose FIP. It's not an easy fix, but I would hope that we're in a much better position to manage the problem within 5 to 10 years. We adopted our cat Bilbo from the Tompkins County SPCA about a year ago now, so he's settled in very nicely into the house. He's a wonderful cat. He's very playful. He charges around the house, chasing the birds and squirrels on the deck, and in his mind at least, so he's very happy.